Today, I am really pleased to introduce Dr. Danielle Varda. She is an associate professor at the School of Public Affairs at the University of Colorado, Denver, and we've had a lot of opportunities to work together. She's also the director of the Center on Network Science, which I think is how I first came into contact with her, and she really focuses on what technology can do when it comes to these really complicated collaborative spaces. So Danielle, come on up.
Well, good morning. It's always nerve-wracking going first. And hello to everyone not in the room. Okay. I'm Danielle Varda, just down the road at the university. I run this center that has about 5 full-time employees. We're also small but mighty. Our mission is we try to help build capacity in communities to engage in collaborative work, and usually by measuring and using data to do that work. So we do that in a number of ways. We do evaluation and research, we do a lot of trainings, and we build technology that we hope help people do that work. So today, I have a couple of stories. I'm going to try to tell this not looking like a professor, but more like a community person. So I'm going to get to the technology in just a sec. Okay, so to start out, I think everyone in the room will probably agree that there's a new norm that all of us are engaged in. We call it the network way of working. At our center, we run a training called the Network Leadership Training Academy once a year, where people come in from all over the country for 3 days, literally just to learn skills on how to build, manage, and evaluate effective networks. And by networks, we mean any kind of set of people and the relationships between them, or organizations and the relationships between them. So I love this kind of graphic. The thumbtacks there are meant to show people or organizations. We call those the nodes, and the lines between them represent relationships between those folks. And what we know is that there's been a real shift in the way that people do their work. So it used to be that we hired people in organizations primarily because, right, they had the right degree and they had the right skills and background, and we still do that, but now we also hire people because they know where to get information and they know how to connect to others. So suddenly people are getting hired in, get asked to work in organizations, honest and being asked to do something, a skill that they may not even be inclined to, that they may not have had any background or experience in. So what we've realized is that while people are engaging in the network way of working quite normally now, quite across sectors, there's really very little way that people are getting to build capacity to do that work. And so we're trying to fill that gap a little bit by saying, how do we actually help people really become good network leaders and good stewards of these community connections? So the problem, I always like to start with the problem, and then and then we'll all get kind of on the same page as network scientists, and then I'll show you these tools. I don't think it makes any sense to show you these tools unless it would make sense why you would use them, right? So the problem that we're dealing with, and I think this is going to happen across a lot of the talks today, we kind of want to know, right, what the magic sauce is, right, of this network way of working. What is it that's actually going to make it work? Is it collective impact and these 5 things we're all supposed to do? Is it bringing diverse partners? There's so many different ways that we're hearing, right? We can do all of these things, and some people even think it's just intuitive. We're human beings, right, and we can connect, and that's what we should do. And then we'll even kind of make assumptions that the more connections we make, the better, that if we, the more social someone is, the better they can build connections. So what I want to kind of do today is disprove a little of these things and let you know that it's actually kind of a science and a bunch of strategies, and you don't have to be the most outgoing extrovert to actually build good community connections. So to answer this problem, I'm going to show it in a few different ways. So the first one is that perhaps the dancing guy has the answers. Has anyone seen the leadership lessons from the dancing guy? All right, so this is taking 3 of my minutes, but I thought it would be fun, especially since we're starting a long day, to start with a fun video. And this is one of my tools to help people think about what I mean when I say network leadership, what it means to actually draw people together. So I'm going to let you watch this for just a moment.
If you've learned a lot about leadership and making a movement, then let's watch a movement happen start to finish in under 3 minutes and dissect some lessons. First, of course, a leader needs the guts to stand alone and look ridiculous. But what he's doing is so simple, it's almost instructional. This is key. You must be easy to follow. Now here comes the first follower with a crucial role. He publicly shows everyone else how to follow. Notice how the leader embraces him as an equal. So it's not about the leader anymore. It's about them, plural. Notice how he's calling to his friends to join in. See, it takes guts to be a first follower. You stand out and you brave ridicule yourself. Being a first follower is an underappreciated form of leadership. The first follower transforms a lone nut into a leader. If the leader is the flint, the first follower is the spark that really makes the fire. Now here's the second follower. This is a turning point. It's proof the first has done well. Now it's not a lone nut and it's not two nuts. 3 is a crowd and a crowd is news. A movement must be public. Make sure outsiders see more than just the leader. Everyone needs to see the followers because new followers emulate followers, not the leader. Now here come 2 more people, then 3 more immediately. Now we've got momentum. This is the tipping point, and now we have a movement. As more people jump in, it's no longer risky. If they were on the fence before, there's no reason not to join in now. They won't stand out, they won't be ridiculed, and they will be part of the in crowd if they hurry. And over the next minute you'll see the rest who prefer to stay part of the crowd, because eventually they'd be ridiculed for not joining. And ladies and gentlemen, that is how a movement is made. So let's recap what we've learned. If you are a version of the shirtless dancing guy, all alone, remember the importance of nurturing your first few followers as equals, making everything clearly about the movement, not you. Be public, be easy to follow. But the biggest lesson here, did you catch it? Leadership is overglorified. Yes, it started with the shirtless guy, and he'll get all the credit, but you saw what really happened. It was the first follower that transformed a lone nut into a leader. There's no movement without the first follower. See, we're told that we all need to be leaders, but that would be really ineffective. The best way to make a movement, if you really care, is to courageously follow and show others how to follow. When you find a lone nut doing something great, have the guts to be the first person to stand up and join in.
All right. So you can imagine I don't get to show that all the time, but I thought this would be a fun crowd. But I also think it's, I think a lot of us might have felt like the lone nut, and a lot of the times the people that we're working with are that lone nut, that person trying to figure out how am I actually going to get all these people to come together and work. And I actually agree that leadership is overrated in this case, right? Like really the power of a network is who's connecting to whom, and leadership only really has a small part of that, but an important part. So while the dancing guy might have the answers for us, I'm going to suggest that also network science might have some answers for us. So I'm going to talk for just a minute about what network science is. Network science is the study of anything, of the relationship between any 2 entities. So it could be between people and things and ideas. The natural sciences use it in those ways. We often look at it as the relationship between organizations and how they're working together to tackle some kind of social or community issue. So I'm going to do something really quick that's going to get us all on the same page about network science and give you a little ideas of how to make sense of these maps. And the reason that's important is because these tools that I'll tell you about will help you make these maps. And so I think it's important to figure out why you would use them. So just for a second, I want everyone to think of themselves as that red node that's right here. And of course, that's you. And we're all embedded in what we call our social subnetworks. And so all of us coming into this room have this kind of strong set of ties that we're connected to. And that's what these little subnetworks are. So I have one, you have one, we all have one. And those people that we're connected to in those little social subnetworks are people who we're typically a lot alike. We call them our strong ties. They're people who we like to spend time with. Like think of last weekend. Who do you spend time with? It's the people you get along with well. You often think alike. Maybe you have access to similar resources and you share interests, right? And so those people are our strong ties. But what's happening here is there's all these ways through those little dotted lines that we connect to one another, and we call those our weak ties. There was a guy in the 70s, Mark Granovetter, who did his dissertation. He was a sociologist, and he asked, how do we get jobs? And he thought, well, I'm going to show we get jobs through our social connections, but what he found was that we don't really get job references through these people because they know the same things we know about. But when we start reaching across our weak ties, we start to find out about jobs that we don't know about. So he called that the strength of weak ties. And that's like a fundamental principle of network science, that there's strength in diversity. There's strength in reaching across boundaries and connecting to groups that are unlike us. And that's that network way of working, right? We intuitively all kind of believe that now, right? That together we can do something better than alone. And if we diversify our networks, maybe we're actually going to do it in a better way. So the thing is, this is all really good. But then this other guy came along, Ron Burt, who's from business, and he was like, wait, this is really ineffective, right? Like, we can't just exponentially increase our relationships. We're going to get overwhelmed, and it feels really chaotic, right? So he said, hey, what if we actually reduce the redundancy in these networks, keep one weak tie to these social subnetworks that we can activate when we need it? So for example, if this is a hard-to-reach population, we might want the gatekeeper as a tie. Here might be a group of politicians. We need to figure out who to connect to. So that way we can start reducing the number of our relationships and actually start to connect to new subnetworks. So Ron Burt would say the person who can think like this is actually going to have more of a collaborative advantage than someone who's over there. So another basic network science principle is that more is not always better. And that's something that is very hard to break out of. We were, in elementary school, we knew like the popular kids had more friends, right? And so we think that's true, and we think we have to be extroverts. But really what I would argue actually in this is that you can manage relationships, and that's really important. I would even say you can manipulate relationships, but I'm a kind-hearted person who believes in the good, so I mean that in a good way. But you really need data to do it. And so I think network leadership is far more about having understanding of the people around you, the perceptions they have of one another, the structures in which they're embedded, so that you can manage that, far more than if you are the best networker in the room. So I'm going to show you a little bit of how to do this, but first, one more story. This is what I like to do, because I know I am a professor, and I know people look at me and go, wow, that academic, she's so in the clouds, so I get it. But so I like to talk about a network kind of perspective in real life. So can anyone guess what this network might be? It's one of my own. Someone can just guess. No, it's none of those things. Those are good guesses. It's planning a wedding, okay? So there's almost 2 stories I can tell you on this right now, but really quick. When I was getting married about 10 years ago, my husband and I were dealing with, like, where do you seat people at the wedding, right? And there's usually 2 ways people think about it. One is we seat people who know each other together because they will they know each other. Or we seat people who don't know each other together because we just know they'll get along, right? And then there's always the question of where do our single people go? How do we work with them? So for this, I said to my husband, don't worry, I'm going to put this into my networks program, and I will map it out, and we can figure this out. So what I did is I coded everyone just by having one connection. There's clearly lots of other codes, and then the colors on there were an attribute, which is what member of a group they were in. My husband's family, my family, friends from college, and things like that. And the first thing you do with a network data set usually is you map it. That tells you if you've done it wrong, right? And so I mapped this out, and I was like, great, look, I've got little 8 tops. This is good. I don't have to do any more work. But then I looked at this for another moment. I thought, wow. This right here, where everyone's connected to at least one other person, is called a whole component. And that right there is mostly my husband's network. This over here is all mostly mine. So I know that's my family. This is his. And then what happened here is I started to realize, wow, look how different we are. Like, his people, they all know each other. And mine are really different, really diverse, from kayaking friends, AmeriCorps friends, grad school. And so I tried to start to make sense of this. And the first thing I could think of was that he's from the Midwest, where all these people know each other and they stay connected forever. And like, the parents go to the kids' weddings of each other's families. You guys who are from the Midwest are like, and you marry like each other's high school sweethearts and stuff. And literally, and I always say this in my talks, you show up on a Wednesday night at your friend's house and say, hey, we were traveling through and we saw you guys were here, can we come? Which happened last night to me with people who called on Tuesday from the Midwest and said, we're coming to town, can we stay with you? It's just true. I'm from El Paso, where we were like 18 and like, what else can we do? Like, where else can we go? And so actually, this was fun for us. What was so fun is last night I showed this to the people who showed up at our house, and they were like, they're in this map, and they were like, where are we? Who am I? And no one's ever asked me that. And I told them, unless they pay me, I'm not gonna I'm going to do any more work on this. But the reason I like to show this is because actually these things I'm talking about are not that far-fetched. We do this in our everyday life. We manage relationships. And if we could only get data to understand how to do that better, we actually might not feel so overwhelmed, right? We actually might save our organizations money. We might all actually be able to say to our funders who are investing in our collaborative work, let me tell you why having fewer connections, but let me talk about the quality of those connections and what we exchange when we connect to them is better than me telling you I invite 50 people to every meeting once a month. So with that kind of in mind, I'm going to show you the tools in a second, but I have to acknowledge that probably a lot of us in the room agree that translating data to practice is where we should be today, right? We call it evidence-based practice. It's like something that's being ingrained into us. We teach it to our students now at the university that having data and evidence bases to make decisions is the right way to go. But that bridge that we're all on is there, but it's very rickety, right? And it's very difficult for someone in a program, especially to take something like complex systems data and translate it into practice is really hard. And we've been doing this for 13 years, and I'd say we're still trying to figure it out. So I kind of have to acknowledge that even though I think there's applications, there's lots of people who use these tools, this is a challenge that we all face is building capacity for using data. And I think it's really important that we stop and recognize that some people are good at it, and some people want to do it, some people don't want to do it, and there's just different ways that we have to think about that process for either legislators or our funders or people in practice. All right. So all that said, I'm going to show you now these two tools that we run out of our center that are available for folks. The first one is called Partner. It stands for the Program to Analyze, Record, and Track Networks to Enhance Relationships. And this tool was developed with funding from the Robert Wood Johnson Foundation. They funded it for about 7 years and then asked us to build a sustainability plan when we went to charging $50 for the tool. So we're not very good at that stuff. But the tool has been, and now we actually charge $100 to use this tool. When you use this tool, it's like a SurveyMonkey, and you can give everyone in your network a survey. It's an 18-question survey that you can modify. You give it out to everyone, and you get data back. And I'm going to show you an example of what you get back. So you can do a full start-to-finish evaluation. We charge a little bit more. We'll do a report for you, or we'll just hit a button, and it produces a Word document with all of your data in it. Our goal is to make this available to folks so people, this has been used in about 2,500 communities, actually in 30 countries, and translated in 5 languages. And the people who use it, 90% of them just find the tool and use it like I just described. We do have people like foundations, the Annie Casey Foundation or the CDC that hire us to do big evaluations for them. That's really what keeps our lights on, are those big evaluations. But small health departments use this a lot. There has been a public health audience for it, primarily because it was funded by the Robert Wood Johnson Foundation, but there's nothing public healthy actually around about it. And people use it in whether you're looking at individual networks or community organizational networks. So just to explain it, so you can go to partnertool.net where it is, and I'm just going to give this because this is a tools session. When you go there, I'm going to give you these quick steps. You would register, and then you follow these 4 steps that are online to do this. So you first have to bound your network, figure out who you're going to send this to. You modify the survey. It has an email system in it so that you can send emails and look for reminders of who hasn't completed the survey. And then you just download the data, and you open actually this Excel file, and you put it all in there. And that's going to sound crazy, but when we're talking to a program manager at a health department and we say open Excel and you can put all of this in there, they love that. They love that they feel like they're not learning a new program. So we've never even changed that. They can email it really easily to each other. So it's made the adoption of the tool much greater because we made the actual use of it easy. And when you open that file, you can draw the maps. There's a whole bunch of scores. I'm going to show you mostly maps right now, but really the beauty in these data are what's behind it. It's the numbers, right? So I'm going to kind of walk through this little story. This is the last part of this presentation that shows you how we used it in one case and how that actually led to this second tool. And so I'll end with just the introduction of the second tool. So when I came to Colorado, I did this work with Dr. Ayelet Talmi at Children's Hospital on the system of care for babies and young children with special health care and developmental needs. So she had been working on this system with a bunch of partners in town and came to me and said, I want to demonstrate what we're doing. I want to demonstrate these connections. So can you do that? And I'm a network analyst. And so we were a great partnership. And she's one of my favorite partnerships of all time. We did a survey using the partner tool. So this looks crazy, right? We gave it to 100 people answered. They told us about each little blue square there is an organization, and the lines show when they're coordinating care for babies and young children with special health care needs. And this is over the whole state. So it looks a little crazy, but you can start making sense of things right away. Like this is called the core, and it doesn't lay out geographically in these maps. There's other ways to do that, but this was kind of the Denver metro area, and what you see on the outside is more of the rural areas. And so we were like, yeah, look at this. We're getting to see there's a lot of investments in this kind of system coming from the federal government, state governments, and even private investors. And people want to show that they're doing something. So we had all kinds of ways to show this. And what we did is we go out to the community when we have data and we say, how can you use this data? How can you use it to do something better with it? So if you use the partner tool, there's a whole module on using the data to translate to practice. In this case, for example, the mental health agency said, well, we want to see ourselves in the map, so we pulled them out. They're the blue nodes. If you pull the yellow nodes out, you see they're actually not really well connected, but we could see that they're kind of covering the state. The different counties wanted us to show how they look. You'll see the tri-county area is far more connected than the rural counties. But here's what happened. So this is kind of the end of this story. We finally got to the families, right, of kids with special health care needs. And we said, hey, here are these data. Aren't they great? How can we help you think about constructing care for your kids in this system? And the parents were like, so the systems people who I just showed that data to were like, wow, we love this. They love data. Where am I? You know, it's fun. They can show their funders and all this stuff. Families were unhappy with us. They said, you're showing coordination of care that doesn't exist for us, and it's looking like something that's not a reality for us. And they actually didn't like our tour around the state. And so in that moment, we had this aha, and we were like, wait a minute, what is a system of care for you, and how is it coordinated? And so we asked them to start drawing their own systems of care. And this is a map of a mother of twins with special health care needs who drew it, and we turned it into a slide. And you'll see here in the center, all the circles are all those folks that are her primary supports, and you'll notice they're all informal supports, friends and family. And so what their message was, that's how I coordinate care for my family. And this system that you're showing me is all this on the outside, and I don't actually want to be a part of it. I only will use it if I absolutely have to, and then I just want an easy way to access it. So the number one thing, pattern, and so then we did surveys with lots of families and asked them to describe their personal networks. And no matter by disease, by zip code, by gender, anything, only one pattern you see consistently across families is that they primarily rely on their informal supports first. And that most people don't want to be in the system. Yet us systems people are over here like building these perfect systems to shove people into, right? So, all right, so what we did, I used to end there and I'd go, and one day I'm going to build this tool so that people can assess someone's personal support network and then connect them to resources. I finally got a call from the Community First Foundation that said, hey, we heard you're kind of peddling this idea. Do you want to compete to be in the Innovators Society, which I got into and competed with 5 other organizations for innovations in mental and behavioral health and built this person-centered network app. So I don't have a lot of time, so I'm just going to show you real quick. What we've built now is this tool that allows primarily providers, but it can be a teacher or a social worker. It's anyone who cares about someone else, really, and wants to help care for them, can ask questions of the person. There's a whole series of questions. It's an app, and it's adaptable just like our other tools. So if you are talking to elderly people, you can put in those questions. If you're screening on food insecurities, you can do that. If you're a young person, we have a kids version. And you ask them a bunch of questions, but you finally get to this one about what they need. This is kind of our slide on who uses it. So we literally have like firefighters in Oklahoma who use it, who go into overutilizers' homes. We're trying to connect them to resources. It asks questions like, who do you rely on when you have problems? These are the network questions, and someone will list their partners, and they literally see a screen like this, and I can show it to someone after, but we hand it to them, and with their finger, we ask them to tell us who knows each other, and then we ask them to tell us who coordinates care for you. Then we also say, to what degree do you depend on these people and to what degree do you trust them? So what we see are people like this who have lots of coordination. This really matters in things like cancer care, and things like this. Those red lines show when there's low trust or high dependency, so that the provider can start to understand, this person that I'm with right now, is it someone who needs more help from the system or not? So even though the person, this is our final one here, might have said, I need help with child-related issues, employment, and food, we ask them, who helps you with the things you need? And with their finger, they draw that. We can see that even though they have people helping them with food, it's a red line. So what we're trying to do is find these places where no one can help them. We want to honor the fact that people want to help themselves first and acknowledge that, and then go to these places where nobody's helping them. We want to help build resiliency instead of dependency on systems, right? But we want to use the system. So when we figure out where they need the most help, we can search by zip code. We're partners with Aunt Bertha, and it can search in any zip code in the country to help find them resources in that area. Oops, I went the wrong way. Very, very last slide. This is my daughter, Olivia, who's 8. I have 3 little girls, and she's my oldest. And you won't be surprised to know that she loves the idea that I have an app, right? And that I can give her this tablet, and that she can play with it, and that she can draw pictures on it, and it feels like a game to her. But what I'm doing, and this is what it literally looks like, and you can so the kids love this. So when you, so one time I try to get the kids to use it to break it. I need those little errors to pop up, right? So one day she said, can I answer those questions? So she answered, how lonely or isolated she is, rates her own health, the things she needs, constructs her little network like this, and then gives it to me. And I'm like, what? Because I'm her mother, and I think I know her the best. And I'm a social scientist, and I'm really geeky about this. I think about it all the time. And here I learned so much from my daughter. Like who she even puts in her personal network, whether she trusts them and depends on them. She rated her health kind of low that day, and I was like, what's happening? But then we realized, she and I, that it wasn't really age appropriate, so we changed it up a little bit. It's fully adaptable, so all we did is put in, for the things they need, you probably can't see this, but it says stuff like schoolwork, confidence, getting angry, being hungry, following rules, trouble understanding others. With a social worker, the 3 of us, my daughter Olivia calls herself a developer, made this list, and what it does now is when kids go through the whole thing, when they get to the screen, instead of these being social determinants of health, they're more mental and behavioral health things that kids are dealing with. And what they can do is, when we still want to teach them resiliency, we still want to help them think about who helps them in their social support network, but when they get to a place like getting angry, they can click on it and it might take them to calming down techniques. These same kinds of things that they're doing in schools where they send them to the computer terminals and they have exercises and things, we're getting a resource directory of evidence-based, age-appropriate online tools that sit inside this app that the kids can get to. So the kid decides what they're feeling, and then they decide whether to go to the resource, and we can track. We're real good at data tracking. Who's doing what and whether they're finishing the resource. And we actually believe this could be like a game changer in mental and behavioral health treatments for kids. A lot of people don't agree with me, but I think if we're not using technology to address mental and behavioral health issues for our young people, then we're just going to miss a lot of them. Because they just love this. Like the moment I give them the tablet, they're all in. And the moment I say, you look really angry, you should go over there and play the calming down techniques, it's totally different, right? So anyways, Olivia will present with me sometimes. She had school today, so I couldn't bring her, although she tried to come. And she's quite good. She stands up here and she describes the app and she talks about how it helps her out and all kinds of good stuff. So anyways, there's a place, if you go to the Center on Network Science, you can find these tools. The actual app we're releasing it's in beta testing right now. Then we're doing the pilot testing. We're doing a call for pilot testing soon, and then we'll try to release it for public use in January. So that's it. Thanks. Oh. And I'm done. Oh, I have
Excellent. You have 5 minutes for questions. Are there questions for Danielle? All right, Carolyn.
So I'm just trying to think about applications for this from a center perspective. So if we are going to be a physical hub for organizations and a virtual hub for organizations working on gender equity, how could we use a tool like this beyond learning how the organizations think, have you worked with collaborative centers, and how have they applied this tool?
Yeah, well, we actually have almost an idea of a combined use of the partner tool and the PCN app. One of the barriers to doing this kind of work is that I'm talking about primary data collection, and I know that's hard. I'm also not afraid of it, but it means people have to report. And one of the interesting things about network data is I always say, like, the only real measure of our relationships, I mean, there's measures like we're all here today, right? We're all sharing this. We all are in the same space together, but it's really the perceptions of one another. So your perception of me and my perception of you is our actual relationship right now. And if you can use data to capture that, you then have a world of knowledge at your hands to then create strategies around it. So one of the things I criticize about shared spaces is that when they come together, it's often that there's implied benefit, but it's hard to see what it is. And sometimes it might be really a social benefit that we do. And so what I think would be really helpful is if you started tracking the actual relationships that are being built among the members and asking them what they actually do together. Do you have a new shared project? Did you get a new grant together? And if you can do that at the earliest stage and get folks to track that almost in real time, then you could start to show actual benefit, right? Or benefit on populations. So one thing we've kind of pitched to this new developer of like a private big developer thing is that they use the app to encourage people to track their relationships all day long and keep a screen in their lobby that shows updated relationships, and that when someone comes into the lobby, they can pick one of the organizations and look at who they're connecting to, what they say they've done. And so it sounds like almost like futuristic. It's not really. We just have to get the right person to say, I want to do that, and actually pay. That's a little bit of an investment. Almost like a real-time Salesforce-y kind of thing inside your organization that you're doing. So I think that is a huge challenge. In the meantime, lots of folks will use it to capture the one point in time. But if you look at the survey on the partner tool, the actual questions are designed to translate right into action steps. Sometimes people want attribution, like, we created ties because of this intervention. That's a really popular kind of question, but has real implications for policy and funding and things like that. So I'm trying to answer fast.
No, it's all good. You're doing great. So, all right. Aaron, you got a question?
Yes. I'm wondering how this ties into other CRM platforms and what its relationship to it is in your head versus if there's any technical interface that you have between, I don't know, we use MailChimp, for instance, Salesforce, that type of thing.
Yeah. Well, actually, the guys after me will probably be able to answer that kind of question.
No pressure.
So I'm like, yeah. So, or I also have a business partner who answers those kinds of questions. But my only real answer right now is for the app in particular, we're building it with the appropriate APIs and trying to connect that. Partner, we never did that with, but we work for Kaiser on their stakeholder engagement work. And they asked us, when we engage in stakeholder engagement, which is their external relationships, so not just internal to KP, but outside, they believe that by building external community relationships, they'll have better business outcomes. And they came to me and said, we want to measure that. And they were just like logging in narrations of meetings with each other. So we coded a bunch of those and created, though, a new interface for them that they can track 10 data points for every interaction they have with an external partner. But then they use their Salesforce to build the interface. And actually, I was just talking about this morning. It's painful for me to watch Salesforce try to modify to become a network database. It's not a network database, which is super clean. But they've long time investment in Salesforce, so they weren't about to change that. So it was very clunky and difficult, actually, to do and expensive for them. So I think it was, though the way we look at it, it was extremely innovative, and what they're actually tracking and the way we're able to track it and show their connections to the community and then the connection to outcomes outside of it are good. So anyways, I'm not answering the actual question you asked because I'm not sure I can without like the other people on my team who could have answered that better. But it's high on our list, and actually what we want to do is reduce the complexity of it. And network science lets you do that because from everything I just showed you, what is kind of unbelievable is that the data structure behind it is so simple and clean. And because of that, it kind of surpasses, I think, other solutions because we don't get all loopy and wonky in that we can connect data bases together really easily because of that one feature of it. That was a really roundabout.
Awesome. Well, if we can all give Danielle a round of applause. Thank you so much for sharing.